Welcome to the SADS Foundation's Living with SADS webinar. Tonight on drugs to avoid with long QT syndrome and supplements, herbs, cold remedies, depression, and anxiety. I'm Marcia Baker, the program director with the SADS Foundation. Dr. Will Heise, our presenter tonight, is a medical toxicologist and family physician who joined the faculty of the University of Arizona in 2015 and became a member of the Credible Meds Scientific Review Board 8 years ago in 2016. He earned his medical degree from the University of Iowa and completed a residency and fellowship at Banner University Medical Center in Phoenix. Dr. Heise is a board certified in medical toxicology and family medicine. He has appointments at the University of Arizona College of Medicine, Phoenix, in family, community, and preventative medicine, and biomedical informatics and medicine. We're honored that Dr. Heise is volunteering his expertise and time tonight. Following his PowerPoint presentation, you may ask questions by typing them into the chat. With so many people on our webinar tonight, we'll address the questions just as many as we can from the written questions as posted in the chat. The webinar is being recorded, so please mute yourself during the presentation and question and answer session. The link to this recording will be sent to you in a few days. And now I'll turn this over to Dr. Will Heise.
Thank you very much, Ms. Baker. As she mentioned, I have prepared some slides, and then we will take a number of questions. The slides are designed to last us about 30 minutes, and I apologize if at points it seems like a list. I was trying to get those supplements that are most commonly used and that they get the most common questions about. So we'll try to make that as interesting as we possibly can as we go along here. First of all, I am faculty for the University of Arizona. I have funding from some local foundations. I have no conflicts of interest with any particular device or supplement company. And so I think that I can say what I'm going to say without bias tonight. I am a board member of CredibleMeds.org, both scientific review committee and board now. After doing this for a few years, and that's because I feel very strongly that Credible Meds provides a really necessary service for folks whose families have sudden arrhythmic death, as well as for physicians and pharmacists and other medical personnel who are trying to do these things. So I am deeply involved with that, and I'm biased that Credible Meds is a really good organization. We are going to look at the safety and efficacy, because this is always a risk-benefit discussion for using supplements and dietary additives. We'll briefly mention some medications, but tonight is designed not to be about the safety of commonly used medications, but about those supplements and dietary additives that we use. There'll be some stuff on common conditions, like the things that people are trying to do, like performance and weight loss. We'll talk about colds a bit. We're coming out of that season a little while, but my kids brought one home from school this week, so apparently it's still floating around. And then we'll talk about depression and anxiety. You'll hear me say quite a few times that we are just at the limitations of what we know, and that's okay. We will do the very best we can to reflect that when it is reasonable to do so, and try not to tell you things that I'm just making up rather than doing that. We mentioned that these are the topics. We'll talk about cold remedies, weight loss, performance, depression, and anxiety. And I'll do those things that I think are most common. And then if you have questions about particular ones, please just ask. Remember, as you all have undoubtedly learned, that there are differences in ion channel and variations between folks who have long QT syndrome and sudden arrhythmic death. And we're going to talk in general terms, particularly around those who have long QT syndromes today. But in general, with the supplements that we're going to talk about, I'll mention some that have specific problematic things, but in general, the avoid or the probably safe applies to most kinds of arrhythmias. Remember that supplements are very loosely regulated and or not regulated at all. Many of them contain what they say they contain, and others do not, frankly. It's always important that you would get your supplements from somewhere that tests them and that pays attention to what's inside of them. I would say that those that you are buying straight from Amazon or similar companies on the internet, I would not necessarily rely on unless it's a brand that I know well. And that places like Costco or your local farmer's market might have supplements that might cost you a little bit more, but are more likely to contain what they're supposed to contain. Now, sometimes not only do they not contain what they're supposed to contain, but they also contain other things. Contaminants are incredibly common. It, fortunately, knock on wood, has been a little while since we've had like a big lead poisoning breakout from some of these. But if you buy these from, if you buy traditional herbal remedies from third world and developing countries, then that lead toxicity and other things can be incredibly common. You know, I live in Phoenix, so we see these with some kinds of herbal remedies from Mexico fairly frequently. You know, I also have run into a number of families who are from India, and Ayurvedic medications or supplements are famous for containing other things than what they're supposed to do. And, you know, some of these things can take a long time to appear. So let's remember that when we're talking about these supplements, we're hoping that there's nothing else in them and that what's in there is what it says is in there. So first is colds. Vitamin C is, of course, something that's very common. I think most of us probably eaten an orange or had some orange juice to try to deal with a cold. There's some data that suggests that this provides benefit in terms of cold severity and duration. It is very water soluble, so you don't have to worry about an excess of vitamin C from the perspective of it building up over time. Essentially, if you took a whole bottle of vitamin C today, all of that would be out of your system tomorrow because you would just pee it out in a dramatically fast fashion. So reasonable amounts and addition of vitamin C to your diet is probably safe. If you take a huge amount of vitamin C, some of the binders that are inside of that may certainly bind up other medications like calcium channel blockers or other beta blockers or other kinds of medications that you're taking. So one of the things that I'm going to say repeatedly tonight is in sort of a normal supplement dose of, let's say, you know, 1 of the tabs a day, you're probably fine. But 20 of them is probably not reasonable and likely will lead to some kind of additional risk for almost everyone. Zinc. So you'll recall that pennies are mostly made of zinc these days. Ironically, I have met multiple patients who eat and who are now copper deficient because large amounts of zinc can lead to copper deficiency. But we're not talking about constant intake of, you know, pennies or of zinc. We're talking about supplementation. It looks like there is moderate data that especially if you start zinc very early into the symptoms of a cold, then it may make it a little bit shorter. That data may actually only support that it's only 4 to 6 hours shorter, but who of us doesn't want to be better a half day before we would have otherwise? So, well, my rule of thumb is if you're taking zinc and you don't actually have it in your mouth, but you can taste a metallic taste and you have a headache and you have nausea from the amount of zinc that you've been taking, then you're taking too much. There's limited evidence for this, as I said, but it's probably safe. So a reasonable sort of like those zinc over-the-counter remedies for colds may be beneficial, probably are only beneficial if taken in the first 12 hours of a cold, but are most likely safe in all kinds of long QT disorders. Echinacea. I feel as if echinacea had its heyday about 20 years ago, that it was incredibly hot, that it was sort of like the big thing, and that it's sort of faded off, at least from my perspective, over the last few years. It probably isn't really helpful, if the truth be told. I have yet to see a convincing study in which it was well done, placebo-controlled, and demonstrated a dramatic difference. So that said, for me, the risk-benefit ratio is too high. It's too high toward the risk side because I don't think that there is necessarily a benefit, and I'm concerned about the possibility of other herbs being co-ingested with this. And so for me, echinacea is not a reasonable supplement to take. Garlic if you have a cold, it probably doesn't do anything for you. But there is a fair amount of evidence that if you just have dietary garlic on a regular basis, that it may actually boost your immune system. And of course, garlic is also delicious. So there's that as well. So moderate dietary amounts are safe. And you smell amazing, and vampire worries are minimal as well if you have garlic hanging around. And so garlic is probably one of those things that is not unreasonable to have in, if you saute garlic up with some olive oil and put it into your food, you probably have achieved the maximum benefits of that garlic, as well as it tastes delicious. So that's what I would suggest in terms of garlic. I don't think supplementing large quantities of garlic is going to do anything for you with a cold, but it's probably safe. So there's that. Elderberry is interesting. There are some very unique randomized controlled studies of elderberry supplements. Remember, these are, again, high quality supplements in which we know exactly how much was in there. And the papers have some particular companies that they sourced it from. I don't know if those are necessarily available in the States, but what they did is they actually did some studies where they did a placebo-controlled trial, and they sent everyone on on long flights out of Australia, actually. So those persons who were about to travel on a long flight out of Australia had some had placebo and some had elderberry. And of course, as you might imagine, after a long exposure to other human beings traveling, the risk of having a upper respiratory infection was reasonably high. But it seemed to be lower, and it seemed to be less problematic in those folks who were given elderberry. So it seems to be safe in terms of QT prolongation, and it may actually be of some benefit. It's not to the point where I feed my whole family elderberry before we go on any trip. But if this is the kind of thing that's interesting to you, go for it. All right, we're going to talk about weight loss. Some of these topics, particularly with weight loss, we did talk about in a couple of years ago when we did this, but there's been some updates, of course, in terms of this. So my favorite way of losing weight is to eat a pizza that looks roughly like this and then go for a long walk, but to each their own. So this is Garcinia cambogia, which is a supplement that is supposedly helps regulate fatty acid regulation as well as serotonergic signaling inside the gastrointestinal system. The data that it is effective is minimal, but it is probably safe, and it does form the basis for some forms of flavoring as well. So that's interesting. I don't think you're going to get much out of Garcinia. We have hydroxycut, which is a common dietary supplement. Anything that has the word hardcore on it is obviously catering to a certain demographic. And perhaps anything with the words hardcore and elite and extreme on it might be something that you might want to avoid. I have a young brother-in-law who would be into this sort of thing, and I would tell him that it would be a poor choice. This is actually true not just for those with long QT syndrome, but also for those who do not have that. It has a huge amount of electrolytes in it, so it can certainly cause electrolyte imbalances, and it has been linked to hepatotoxicity as well. I would not take this. Orlistat is a common supplement. It actually prevents the breakdown of fat within your gut. It works because you don't absorb that fat. The bad news, of course, with that is that fat has to go somewhere, and that's straight through your intestinal tract, resulting in fatty stools, frequent bowel movements, and flatulence. On the other hand, that may encourage a low-fat diet because you realize that you don't want to experience those things on an everyday basis. So this is one of those dietary supplements that works, but is not necessarily much fun as you start it, unless you're able to adhere to a low-fat diet, in part because of using it. So there's that to consider. I think Orlistat works and it's safe, but it's not necessarily delightful to use. Meritrim has a great name, right? Anything with trim in it. It changes fatty acid metabolism. There is a study, it was a relatively small study, that showed that healthy volunteers lost more weight with Meritrim than without it. In this study, both groups lost weight. They had strict caloric control, but it maybe helped with the amount of fatty acids that they were going through. There is very little data. It is, I'm going to say perhaps safe. It is one of those ones that I think that the benefit is such that it would be hard for me to sit here and tell you that the risk benefit is such that you should absolutely use it. But that would be something to consider anyway, as it seems to be somewhat beneficial. There is glucomannan. This is a common supplement that basically is a bulking agent. So you eat it or you take the pill, it absorbs water, it swells up into a bigger, not this big, hopefully. Your stomach is probably smaller than that. But anyway, it swells up. You take it before a meal with lots of water. It helps you feel full. It does give you bloating, as you might imagine, from something that's designed to get bigger inside your stomach. And you have soft stools, but generally not like the flatulence and extra stools. They're just they're soft, which is not necessarily a terrible thing, especially for those folks who have constipation. So it is a reasonable agent to use in order to decrease caloric intake. On the other hand, we have bitter orange, which is in the same category as things like ephedra, mahuang, phentermine, and all stimulants. Those are certainly not safe in folks with dysrhythmic disorders, and I would not suggest doing that. The same thing is true. There's some forms of geranium. I think it's sometimes advertised as geranium oil or geranium. I can't remember, but that is also a stimulant and something that I would avoid in these cases. It's just, again, the risk-benefit ratio is just not there. The evidence that it actually helps you lose weight is very, very moderate. And then there's that. I didn't put that in here, but just as an aside, of course, we have Ozempic and Wegovy and all these GLP-1 agonists now that are available on the market. We weren't really specifically talking about drugs. But those drugs are new drugs. They've had thorough QT studies. So far, they appear not to be linked with QT prolongation. It's important, of course, that one maintains a healthy dietary intake of electrolytes and other normal amounts of dietary intake in order to prevent the development of long QT when you're taking those. But in general, those newer GLP-1 agonists that are sort of all the rage right now, and that are genuinely helpful and good for diabetes, good, like huge amounts of weight loss, it's quite impressive, are most likely safe, at least from that perspective. I think that it would be nice if we had it, if we were taking drugs that have been on the market for 50 years, so we knew what the long-term effects are. So I can't guarantee what any of those are. And as a toxicologist, I'm naturally cynical, I think, at times. All the people who are helped by various medications, I see them, but guess who comes and sees me in the hospital or in clinic? Those persons who are hurt by a particular agent. And so sometimes I feel like my bias is to worry too much about things compared to the benefit that they give lots and lots of people. So we'll talk about a few things that are sort of designed for quote unquote performance enhancing. Caffeine, of course, is the most commonly consumed psychoactive substance in the world. Had some today. It was marvelous. It does boost metabolism. It helps with fat burning. There's a reason it's in a lot of things. I don't really probably have to tell you all the side effects of caffeine, right? Like jitteriness, anxiety, insomnia, gastrointestinal reflux. But it does appear to be safe in reasonable doses, right? And reasonable for one person is a little bit different than another. But let's just say we try to keep it 200 milligrams of caffeine a day or lower. So that's like 2 large coffees or 4 espressos kind of thing. We have shrooms or all kinds of microdosing psychedelics. These work via serotonin to alter your level of consciousness or make you experience things that are different than what's actually around you. There's no consensus that these give benefit, although I know that they're hot in Silicon Valley and other places around the country. Of course, anytime you have psychedelics, you're going to have a lot of stigma and politics that are involved with this. The dosing is inconsistent and can be hard to figure out. I was in Amsterdam this spring, and they have this for sale most places. And I think that they probably have it fairly regulated and moderated in terms of the dose that you receive. There are limited studies on this. It's challenging to study in this country, but we're moving that direction. I know that the state of Arizona, for instance, has recently started to take public comment and is planning to fund some psychedelic studies. But it is probably safe in terms of cardiovascular toxicity. But you just have to make sure if you're going to use shrooms that you're with, like, I would say that you should have a safe person. Again, I've seen where it's gone very wrong and people have jumped off of things or done silly things to themselves when doing this. I personally would love to try psychedelics, but I haven't gotten quite brave enough yet to do it. So we'll see if that changes at some point for me. But I am sort of fascinated by these, admittedly. Some folks use cesium chloride as a detox quote agent and for performance enhancement. Please do not take this. It actually, so the reason there's an SR71 on here is because there used to be an SR71 fuel that contained cesium that was designed to be used to create a giant radio opaque cloud, a radar opaque cloud, in order to prevent the Soviets in time of war from being able to target SR71s. But it was only to be used in time of war because it's just such an incredibly toxic chemical. People with normal hearts had dysrhythmias, prolonged QTs, and some other really bad things happened to them. So if they're burning it in rocket fuel and they were only going to use it in time of war against the Soviets, the rule should be not something you should take in a supplement. Just, I'm going to paint with a broad brush there. All right, let's talk about some psychiatric supplements. There is evidence that is mixed for both depression and anxiety with the use of omega-3 fatty acids. It seems as if those omega-3 fatty acids that are within normal and varied diet are more than sufficient for those benefits. But on the other hand, at normal supplemental doses, these are incredibly safe. They're naturally occurring. You can get it like fish oil capsules. And I wouldn't sit here and say that it's not something that I would try. I think that it would be reasonable to either try to increase the amount of omega-3 fatty acids in your diet or to take supplementation when you're trying to sort of adjunctive treatment, if you will, for depression and anxiety disorders. I don't think it's going to cure it in most cases, but it may in fact be helpful. Vitamin D is one of those things that has, again, I think had its heyday, is still incredibly popular. The data for efficacy in terms of depression is very mixed. And you'll find one study that says it was incredible, and you'll find one study that said it did nothing. And those studies are, I think, equally well done. But at higher doses, it certainly changes calcium levels and calcium concentrations in serum. So I would not take high amounts of vitamin D in the setting of potential arrhythmic death. The benefit is just not there, and the risk for calcium, abnormal calcium, is just too high. SAMe, which is what we say for 6-adenylyl methionine, because that is hard to say. The evidence is limited and conflicting. This is actually a straight created synthetic supplement that's the precursor for neurotransmitters, including those that are part of depression and anxiety, like norepinephrine and serotonin and dopamine. But the data, there isn't a lot of data on its safety, but in general, it's considered safe. So the idea is that there's sort of a consensus that this is safe. We don't have to necessarily chase it down, but I don't think that it's particularly helpful from the perspective of an everyday use, or something that I would suggest to my patients for treatment of depression or anxiety. A brief aside on medications. Whether you're treating mild intermittent or generalized anxiety disorders do matter in this case. In terms of the safety from a cardiovascular toxicity standpoint, lorazepam, diazepam, buspirone, and duloxetine appear safe. Citalopram is, of course, the classic SSRI that causes issues with long QT, and I would use other SSRIs. And then tricyclic antidepressants, or TCAs, are an old class of agents. They're now being used off-label for a lot of things. Can be incredibly helpful, but I would avoid in these situations. Now, That said, if you have generalized anxiety and it's long-standing or a loved one does, buspirone and duloxetine and SSRIs that are not citalopram are probably the best thing to use. When you use lorazepam and diazepam or Ativan and Valium, you get long-term GABA signaling, risk for withdrawal. It probably makes depression worse. And there's a lot of other issues with using these benzodiazepines long-term. But in terms of cardiovascular toxicity and for short-term use, that's okay. We do have a nice list of incredible meds that talks about therapeutic options for treatment for medications. There's also a really nice chart now, Incredible Meds, talking about other clinical states and risks and benefits. And so I would direct you to that as well. In terms of anxiety, magnesium is something that's often been touted as being helpful. This is, of course, magnesium burning in a Bunsen burner. If you've ever burned magnesium for starting a fire or something, you'll do it again because it's quite fun and bright and interesting. But it seems that low to moderate doses are in fact helpful for those with anxiety, but most in those who are deficient. However, it is not unreasonable to use a low to moderate dose of magnesium in the setting of having a channelopathy, because if anything, in general, it sort of tones it down, if the truth be told. But at high doses, you may experience unexpected ion channel changes. In addition to, if you take a lot of magnesium orally, you will get rip-roaring diarrhea. And so I usually suggest a low dose of that for folks. That's why milk of magnesia works so well as a cathartic agent for constipation. And then there's valerian root. So valerian root is a traditional herbal supplement. It basically is a GABA agonist similar to Ativan or Valium, also called lorazepam or diazepam. The issue that I have with the valerian root is that you don't really know what dose you're getting, that you might take it from the same place and you think you're on a steady dose, but it might be not so reliable. And it basically is like taking a benzodiazepine in low dose in terms of its efficacy and in terms of its side effects. It is somewhat sedating. There is a risk of withdrawal, potentially life-threatening withdrawal if you don't take it, but it has no specific issue with long QT. So pluses and minuses there. I'm not a huge fan of valerian root, but I can't say that it is the worst idea in the whole world. Probably the worst idea on this whole thing are those stimulants, if the truth be told. Okay, this is a picture of the Grand Canyon, which means we have reached 5 p.m. and the end of our slide set. So let me stop sharing here and get out to the chat.
Thank you, Will. We've had a lot of questions, comments coming through on the chat, and you can just start. The first one is from the Steph's iPad.
Yeah, so let's see. Long QT syndrome 1, low potassium and magnesium are issues. Take a potassium med. Why should I take a magnesium medicine supplement? So remember that potassium channel changes are generally those that are required to return the heart to resting membrane potential. And that in general, having a reasonable magnesium level is associated with that channel being able to work its best. It's a cofactor, actually. And so having a normal magnesium level is something that you would want to have. Whether or not you need to have supplementation for that is a matter that's up for debate. For most human beings, you can have a normal serum magnesium level that is as protective as it's going to get without supplementation. And probably at some point you've had a magnesium level in your normal state of health. And so I would say if it's low, it would be reasonable to take a supplement. And if it's normal, then you don't really have to do that. Cannabis or CBD. All right, so let's take these as two different things because that's what they are. CBD is derived from cannabis. It is not the psychoactive portion. It is the portion that is most associated with sort of the anxiety calming effects of cannabis. I'm just going to come out and say that CBD that's not taken orally or not smoked does nothing, right? You can rub it on your skin. There's a great placebo effect. You knock yourself out with CBD. That's why it's available in so many things for topical use everywhere, because it doesn't do a thing. But in terms of oral use, or smoking of that, it can be helpful for short-term management of anxiety. And there is emerging evidence that cannabis use over time can do that. The main problem that we experience with cannabis use is escalating doses. So if it works well for you at a low dose and you can stay on that low dose, it probably is somewhat efficacious and helpful. Increasing doses that escalate over time are associated with a lot of hormonal imbalances, as well as significant amounts of nausea, vomiting, and then electrolyte abnormalities in those persons who can't continue to use their dose. So what I would say is cannabis is okay, but in very low doses. And of course, only for adults. I take care of a lot of kids who get their parents' gummies, so take care of your gummies if you have edibles. Or gummies or cookies or whatever. I had a kid that ate a whole bag of Cheetos. It was like 500 milligrams of THC the other day. Let's try to not do that. I'd be more interested in hearing the risk of the actual plant or med, not how effective. Yeah, so I tried to balance a discussion of effectiveness and risk in all of this. If you have a particular one that you want me to talk about the risk, then that's fine. I tried to sort of do a risk benefit analysis of these for you. All right. Federal research on THC, very cool. We need to look at THC and CBD separate. I agree. THC is a hard no. This is probably true. It depends a little bit on which exact signaling mechanism it's going through. But in general, I completely agree with who wrote this, Denise Valenti. Yes, and I talked about this as well, that low THC and or low dosing may in fact be helpful, but high dosing has significant problems. Horse chestnut and pine bark for vein support. So I assume this is, are these safe? I do not know off the top of my head. Let me take a quick look here at PubMed and see if I can find an answer for you. I see no data for horse chestnut and pine bark. I doubt I'm going to have much success with pine bark. Pine bark smells really good. I'll say that for it. All right, let's see what we got here for pine bark. I see no data on QT. And I see no data on Torsade from what I would consider to be reliable choices. So I think that can mean a couple of things. Personally, I think that it is probably reasonable to try. What I know about these is that the data, again, for efficacy is mixed, and that the risk ratio is probably not zero, but it's probably quite low. So I guess what I would encourage you to do is do one thing at a time. Don't add multiple agents at the same time, but perhaps doing one or the other, and make sure that whatever supplement you're taking is not a cocktail of a variety of things that you don't know what they are. I would always encourage folks that if you're taking a supplement and there's a list of ingredients that's this long, make sure that you check each of those ingredients, because half of it may be safe and there might be something in there that's not. Functional mushrooms. Yes, functional mushrooms are just fine. These in general, those ones that you're buying from a reliable source are quite safe. I have seen folks who go out mushroom hunting on their own, and that has resulted in dysrhythmias. So please don't go pick your own mushrooms unless you really, really, really know what you're doing. But if you're buying them from a store, it's probably fine. Safe amount of magnesium. Can one use too much? Absolutely. I think we said that magnesium, you can have too much, and that I think the first symptom that you're going to experience is diarrhea. But that in general, let me see, I was just checking to see how much is in some common supplements. Hmm. Something like 400 milligrams. So common supplements appear to contain something like 250 to 400, maybe 500 milligrams. That amount is reasonably safe. When we give folks treatment to prevent torsade in the hospital, we generally give them a gram or two. And the bioavailability of these is such that you're probably only getting a 50% absorption of that 250 milligrams of magnesia. So I think that that's safe. When you start to get more than 4 a day, I suspect you're going to get significant symptoms and you're not going to get a whole lot of benefit from them. And that this question then following that about taking too many electrolytes, the same thing applies. So it turns out that that ions like calcium and magnesium and potassium, when taken orally, all bring water in because they're charged, and if you will, water sort of likes it, quote. And so the first sign often of too many electrolytes or too many, another way of saying this is too much metal supplementation, right? These are all metals, is that diarrhea will occur. And I suspect that that is the demonstration of your body reaching the limits of what it can absorb. And that probably says this is a little bit too far. Can you absorb too many electrolytes and cause yourself to have risk? I think that you can, but you have to really push it hard. You'd almost have to be trying. CBD. So, oh, another comment from Denise, who does the CBD stuff about having eye pressure elevation. And this is again true with CBD when taken orally or smoked or something. Again, on skin, if it makes you feel like you're soothed, then that's great. How high is too much vitamin D? All right, so my argument with vitamin D is that it has relatively little demonstration of benefit, except in those persons who have truly been demonstrated to be um, de deficient in vitamin D. Okay, so if you have symptoms that make sense that for a vitamin D deficiency, and then you get a vitamin D level and it's low, then vitamin D supplementation in something like the 1,000, it's done in international units, so in the 1,000 to 5,000 international units a day is reasonable. Sometimes you see it in micrograms, like I think that's 10 to 50 micrograms as well. So my suggestion is that these that are like 25 to 50 micrograms one a day is reasonable for supplementation. On the other hand, you can just have a diet that you select that's high in vitamin D. It's easy to find what that is online. And that if you go significantly over that, then you could potentially drive down your calcium levels. Because remember, one of the main things with vitamin D is calcium regulation, and it will take that calcium and will push it into bones. And that's good for long term, right? That's what we're after, is we don't want osteoporosis. But if you take all your calcium and push it into your bones too fast, then you don't have any circulating, and that can become potentially problematic. Over-the-counter magnesium, I think we've talked about now, so I'm going to keep going on that one. A new Credible Meds app will be coming out very soon, actually. Good question. So a couple things on the app. The app is going to have tiers. There will always be a free version designed for families and patients with arrhythmic death, and that is a high priority for us. On the other hand, we also have a lot of users who are in pharma, who are in hospital systems, who are using it for a commercial use. And so what you'll see is that there's going to be a pro version that's a paid subscription that gives those persons who are doing it, who are doing science with it or developing new drugs, that will be a paid app subscription. But there will always be a version that is free, and it will be a new app. And we were planning on it coming out by now, but it always takes longer than you think. So pretty soon there will be a new app. I guarantee a free version that is good. But if you want to support Credible Meds and the work that it's doing, then please feel free to buy a subscription. Oh, I almost added ashwagandha. I'm gonna not pronounce it right to this talk. It was the one of the ones that just barely didn't make the group. So again, I feel like I'm sort of a broken tape on these things, but mixed evidence for efficacy. If you look at the sort of systemic reviews that have been done most recently, I actually have one of them up here. It says we found that there was a reduction of anxiety. This is a systematic review and meta-analysis. So he said it reduced anxiety and stress level compared to placebo, but the certainty of the evidence was low for most outcomes. There appears to be a beneficial effect, but high-quality studies are needed. The number of studies of ashwagandha in terms of QT are a grand total of 0. And so I have no data on its safety. And ashwagandha is one of those ones that I would be very careful of what else is in that supplement with it. So I can't tell you for sure whether it's safe or not. There's low-level evidence that it seems to be beneficial. Creatine, safe for a teen. So yes, if it's creatine, check. Make sure it doesn't have a ton of other things in there, like stimulants, or a really common thing to find their way into some of the same products. Because it'll be like energy, muscle boosting, whatever. I don't quite have teens yet, but I have talked to some teens who do like bodybuilding and other things. And what you want to just make sure is that it is in fact just creatine. I mean, creatine is just large amounts of protein. So creatine in and of itself is safe, but please check and see what else is in there in order to make sure that that's the case. All right, we have a reference for CBD elevating IOP. Again, entirely believe this when taken orally. Let's see, L-theanine. So L-theanine is another one that I actually had looked at for this, and I will reiterate sort of what I said for ashwagandha, and that is that there is no data on whether or not it is safe. On the other hand, compared to ashwagandha, which is sort of a classic plant-derived supplement, usually L-theanine is synthetically created and is found in slightly more pure mixtures. I have to say that the data for it is low level, but it appears to be potentially helpful. It's the kind of thing that I think would be reasonable to try. I would start at a very low dose and see how it goes for you. All right. A safe med for seasickness. The best data and the safest thing for seasickness is like C-bands, which are some of the ones that they use for pregnancy hyperemesis as well. So it's just like it's a band that goes around your wrist and it basically does a pressure point. But the evidence for the efficacy of C-bands is actually quite good. It's like SEABAND, I think, is one of the I think it's a brand name that I'm using because it just, it rolls off the tongue really easy. So I'm sorry for that, but you can just call it an anti-nausea band if you want. And so there would be 0 potential issues with that. And again, the data is actually pretty good. So I think I would start with this kind of like band sort of acupressure approach. And then Steroids can be helpful if you're experiencing it a lot, but most of those drugs that are used for seasickness, which is why I know you're asking about it, are those that have some known risk. So I would start with those things, those supportive kinds of things as first. All right. Nasal polyps, budesonide capsules, and a sinus rinse. Budesonide should be fine. I wouldn't worry about that with prolonged QT syndromes. That like it sort of shot up your nose. I don't know about this whole capsules thing. In general, there's like nasal sprays that you can use with some steroids in them. You may find that those are cheaper. Maybe there's something that an otolaryngologist knows about a particular capsule and nasal polyps that I don't. That's entirely possible. Do you know of any probiotics that are not advised? I don't know of any specific ones as long as it actually just contains probiotics. Again, it's relatively rare that they're co-formulated with stimulants and other things that are concerning. So as far as I know, probiotics in general are pretty good. CoQ10 is fine. Melatonin is also fine. Remember, melatonin, one of the interesting things about melatonin is that it is really helpful, but it's especially helpful at really low doses, which is weird to me. Generally you would think, oh, a higher dose is better, but most of the data on efficacy is like around 1 milligram, but you can buy a lot of like 5 and 10s around these days. So generally we buy the 5s and I break it into quarters if I ever take it, which is typically for like transatlantic flights and stuff for me. And I think it's safe. You don't really need 10 milligrams. It doesn't do anything. Feel free to break it up. Post-surgery anti-nausea medicine safe for long QT. Yeah, so I would direct you to the therapeutic options, not on the drug list. I'll put a link to this into the chat right now. And it has a number of really excellent suggestions in terms of, let me make sure that I'm getting, oh, I actually dropped the wrong link. Let me do this. There we go. Therapeutic options. And so these are drugs that we have in most cases evaluated and found that the data is quite good, that it's going to be safe. And so if you go through that, you will find a number of treatments for various and common things. And so I would really direct you for all of those kinds of questions to that list. Minimal dosage will not affect lung QT, but will you be able to advise the safe dose for edibles? I assume we're talking about cannabis edibles. The safest dose is not using it, just like with any other substance. But I certainly would not go above 10 milligrams. I have seen dysrhythmias with more than that. Powder form of collagen, probably okay. Check what else is in there. I'm going to say that 50 times more probably tonight. IV therapy, IV vitamin therapy, check what's in there. Sometimes you find that they contain large amounts of caffeine or potentially stimulants. Make sure that what you're getting is just vitamins. I did look at the B vitamin data as well today for depression and anxiety, and it seems as if it might be moderately helpful. Workout supplements. All right, I think we kind of mentioned workout supplements. Again, make sure that there is not stimulants in there, but if it is in fact just protein, then that's fine. Yeah, that's basically what it boils down to. You don't want ones that have a bunch of other stuff. You want those that have creatine and protein. All right, anxiety medicines. Prozac, which is fluoxetine. So this is sort of this question from Alice Laura is a good one. It's one that we get an awful lot of the time. The medicines that you've been on for many years successfully. In general, if you've been on a medicine for many years successfully, and it's working well for you, then we just say continue it. It's reasonable, it's working. Don't fix what ain't broken. Realize, however, that when you start another medication, or you increase your risk for QT from other causes, then you might need to go off of this. So for instance, if you're hospitalized with a heart condition or you go on to some other medicines, make sure that they're not going to interact and increase the serum concentration of this. So I would say continue things that are working well for you, but be cautious when you add other substances. One of the things that we discover when we're talking about taking care of people with drug-induced prolonged QT syndromes is that many times there's like, when they're on drug A, it's fine. When they're on drug A and B, it might even be fine. But when they go on to drug A, B, and C, then suddenly bad things happen. And so that's what I would give a caution of if it's working well for you, please, it's reasonable to continue it. And don't fix what's not broken. But if you're going to break it or change it in some way, then please go back to it. All right, normal OTC vitamins. So I think we've talked about B now, which is that it's might be helpful. Again, I'm just going to say sort of the regular dosing of one supplemental tablet a day of these is probably fine. This is true for all of them, A, B, C, D, and K. But large amounts of them, particularly vitamin D and its regulation of calcium, can be potentially problematic. So be reasonable, and it's probably going to be okay. Recommendation for spring allergies. So we already mentioned for one other thing, steroid nasal sprays, and those can actually be really helpful and are quite safe. Probably the data for efficacy is better than that for most of the sort of for most of the for seasonal allergies. And topical use of essential oils is always fine. Just keep them out of your mouth. I will just say that I don't find essential oils to be potentially useful topically in terms of treating anything, but they smell good. And so if you want to do that, knock yourself out. Through the C-band, this is great. My son threw the C-band off the side of the boat when it didn't work. Yep, sorry. I tried. Good. Collagen safe, yes. From a pure and reliable source, sure. All right, then we have these things, adult performance enhancement supplements. So I assume that we're referring in this case to those treatments for erectile dysfunction or for making one's libido higher or one's penis larger or stiffer. In general, those contain either a stimulant, which we would of course want to avoid, or other medications. There's some of them will have things like sildenafil or the active ingredients in Cialis and or Viagra. And there's the risk of those agents in terms of causing QT prolongation. We lack data that those are going to be problematic. So those are probably okay. I think in terms of this, I would encourage the use of medication treatment as opposed to supplements, because the supplements that are designed for quote like male performance or increased libido tend to have a lot of crap in them that you don't want to have, and that is potentially problematic and in the stimulant family. So I would encourage the use of generic, relatively inexpensive these days, Cialis and Viagra, sildenafil type treatments before you do this. Hopefully that answered that question. L-carnitine is probably safe and mixed data on efficacy. Beet juice. All right, so I like beets in my salads. My wife is from Australia, so she likes beets on burgers, which I think is weird, but beets taste good. They're interesting, and in moderate amounts, they're probably reasonable. Actually, I think we did beet juice in the session 2 years ago, and I think the answer was that the efficacy data was low, the safety data was pretty good. All right. Branched chain amino acids. I don't know much about branched chain amino acids. Let me see if I can find anything for you. I don't really even know what one does with branched chain amino acids, if the truth be told. I'm just going to tell you I don't know about that one. I don't find any immediate data that it's problematic, but I'm not even sure what one does with such a thing. Prozac. Yep. All right. I agree with what Rachel says, which is that if it's a brand new medicine, then you need to be careful, and you need to make sure that you're getting an EKG. That's particularly true for a lot of medications that are used for depression, that their use is reasonable, but should be done in a careful and controlled manner. We were talking about someone who's been on it for many years and has done well. Woo. All right. BCAAs, I'm learning things here for muscle recovery after working out. Interesting. Well, I mean, amino acids are just proteins, basically. So it's probably okay, but I don't know that for sure. You should probably check with somebody else. D-ribose. So D-ribose is a supplement that has, my understanding is pretty mixed data. It's sort of supposed to be an anti-aging kind of thing, an anti-inflammatory agent, probably safe, potentially a waste of your money in terms of its in terms of efficacy, in terms of actually preventing aging or making your brain younger, but it's likely safe. Oh, vaginal estrogen. So that's a great one. Vaginal estrogen has a black box warning, but there is zero evidence that it has ever caused actual issues when used low dose and vaginally. And I highly recommend this to patients who are having pain with vaginal intercourse and or vaginal dryness. It also seems to help really well for hot flashes, and the total amount of systemic absorption is actually quite low. So low dose vaginal estrogen, when we're talking about like supplements that not only help with sorry, I lost my train of thought there. Vaginal estrogen is a really good treatment for menopause, and for vaginal dryness and for dyspareunia, which is painful intercourse. And I encourage folks to take it and use it. Very minimal side effects. And it's a great medication that's probably underutilized. Probably it's one of those things where, like, if it was a male problem, then everyone would be on it, like Viagra, right? But women are tougher than men, so they just deal with things. But we should probably have a lot more people on vaginal estrogen. All right, enough sideways of that. Non-benzodiazepines like Zopiclone. So they also work through GABA channels. You can also have withdrawal. They're also a bit, they can create dependence and dependency. And I don't necessarily recommend that people use them unless they really need to. And then if they do, for short term, with a clear time of when you're going to stop. In terms of safety, for specifically cardiac toxicity, they're safe. So no issues there. I think there might be some more questions on a Google Doc that we can do later, but I think we're just about out of time here. Licorice root causes electrolyte abnormalities, particularly with potassium, which is really problematic for lung QT. So please don't do that.
Okay. Thank you. Thank you, Dr. Heise. We have completed all those questions in 1 hour. So I think we will call it a great night, and we appreciate your input and guidance on all of these supplemental kinds of questions. So thank you all for joining us tonight. And you can watch the recording for a review of the presentation too. So have a good night. Thank you.
Bye, all.